Hi, everyone. Want to welcome you to this episode of VBC One Take. I'm very excited for our guest today. I've met her. I'm impressed. Very inspirational. I'd like to introduce to you Shital Daftari, who is CEO of SNT Biotech. Welcome, Shital. Glad to have you in studio today.
Thank you so much, Shannon. Dr. Shannon, it's really a pleasure to be on your show. Thank you for having me here.
Awesome. I would love for our audience, One Take is all about educating the community, imparting to them information so that they can do their jobs better. And I would love for them to get to know you a little bit better. So maybe you could tell us a little bit about S&T Biotech and who you are too, so we can get to know you.
Absolutely. My name is Shital Daftari, and I'm the founder and CEO of SNT Biotech and SNT Biotech Lab.
That's fantastic. And I know that when we met, we talked a lot about your pursuit of education. I think it's impressive. I know we're coming up on the women's conference that's taking place in Scottsdale, Arizona here in just a week and a half at Rise. And I think it would be great for folks to learn a little bit more about you as an entrepreneur, maybe your educational pursuits. And then if you could bring that into talking about what led you to create S&T Biotech.
That's a lot of questions, but thank you so much for asking. Let me share a little bit more about myself. My business, SNT Biotech, has been around since 2011, and we were in the medical and lab supply space. During the pandemic, we were lucky enough to be an answer to the pandemic, and we shipped over 15 million COVID test kits and kept all the labs and hospitals nationwide open during those critical times. At that time, I learned firsthand how the disparities that existed in the health in underserved communities. And that's what led me to think, how can I make a difference? I was uniquely positioned with the lab supplies business, and I wanted to see how I could impact and improve health outcomes in these communities. So that led me to build my own lab, which is now SNT Biotech Lab. And we also built a tech platform that could address health disparities and give real-time dashboards to manage populations' their health and testing needs.
I love that you guys are responsive. And I find that in our conversations, I'm always learning how you are in pursuit of improving your own education. And then also, though, pursuing and improving on the offerings that you're providing. Maybe you could talk a little bit more about that. I know you mentioned the dashboard, but some of the other things that you've built in response to what you've seen out in the community and within the healthcare industry at large.
So at that time, one of the things I'm a strong believer of is lifelong learning. I'm very passionate about lifelong learning. After the growth that my company had seen during the pandemic, we were lucky enough to be on the 3 times on the top 50 fastest growing women-owned businesses in the country. We were 2 times on the Inc. 5000 list. We got the Senior Award for fastest growing business, and we were also named on the Crane's list of fastest growing companies. That led me to think that with all this growth, what can I do better? And how can I be a better leader? So I applied to Harvard Business School, and I just completed the OPM program at Harvard. During my time at Harvard, I got to fuel my passions for entrepreneurship, and my other passion is to grow a scalable business. But most of all, I wanted to make an impact. And what I learned at Harvard is how to build a decent business decently. And that we are right on the track for that with what we are doing currently with SNT Biotech. Very close to my heart, what we are doing, and trying to improve outcomes of health outcomes in people in underserved communities, meeting them right where they are. Traditionally, the belief is that people come to get help, but how can we take the help to people and meet them right where they are? And that's what we are trying to solve.
I love that. I hear so many things in your answer and would love to hear in your words what differentiates you, because you're being responsive to the community. You mentioned about being an entrepreneur. I definitely think you're innovative. what is it about what you're doing with your company that differentiates you, say, from others that may be in a similar business in the space?
Absolutely. So what we have built is an end-to-end platform to close gaps in care in underserved communities. When we say end-to-end, our solution entails everything from building customized kits, mailing them to members' homes nationwide, reaching out to the members and doing follow-up via call, text, and email, and a whole AI-enabled tech platform with live dashboards, a CLIA and COLA accredited lab to do the lab testing, as well as sharing the results with the physicians. So we believe that we've built an end-to-end solution for closing the gaps in care. I think our solution is especially useful when working with Medicaid and Medicare members of health plans, which and the health plan operators. It gives them complete control, reduces administrative burden, and gives them real-time dashboards into the whole project, how it's going, and what ROI they are getting right on in front of their eyes. And I think one of the things that people love about us is how transparent our entire solution is. All the answers are right in front of them. That makes us a very valuable partner for our health plans that we work with.
I just spent the day chairing a conference and we were talking about the theme was around how you can't manage what you can't measure. And so I think analytics are so important. I want to pick apart what you said about the end-to-end solution. And maybe we could start with, you mentioned about being omnichannel. So being able to text, to call, send letters. Talk a little bit about what other strategies are you using to engage these populations. And I know you talked about you like to help in your mission driven as far as helping with underserved communities. What is it that you're doing? Not just the vehicle of getting the message out, but what is it that you're doing to improve the message going out, being received in a way that people are actually taking action?
Yes, 100%. So one of the things I did not mention was the multilingual outreach. So we meet the members exactly where we are. So we make tailored kits based on their demographics. We also have AI-based reports, which tells you what zip codes we are targeting, what ages we are targeting, what race we are targeting. And we create customized messaging tailored to these populations to meet them, not just by their race, by their zip codes, by their lifestyles, by their age group. For example, people under 60, they don't perceive there's a lower perception of risk when it comes to screening. So things like that, we incorporate all that into all the messaging that we build. And everything is built to meet the members where they are in their language, multiple languages. We also partner with community organizations. We help even going out to underserved zip codes. We help mobile van programs as well. So there are a lot of strategies that have worked and that we are implementing currently. And the goal is to meet the people where they are. There are people we see that are a lot of barriers. So how are we tackling those barriers? Barriers of transportation, barriers of language, barriers of knowledge or lack of time, awareness. So there's a lot of points that go into that. And we put all that into consideration and tailor our communications that helps the ROI, helps the compliance rates drastically higher.
Awesome. And you've mentioned AI, and I know you brushed upon how you're using it. Could you talk a little bit more about that? What is it that the use of AI makes what you're offering that much better than, say, what else is out there?
Yeah, absolutely. So our AI is built into our platforms to give all kinds of predictive analysis of the kind of members that we are outreaching to, building customized messaging to meet those members, as well as giving data-driven reports that can be really help our health plan partners with other engagement strategies as well. If there are what the reports that we are giving our health plan not only help them in closing these gaps in care, but they're also implementing these reports in other outreach measures that they're utilizing it.
And you mentioned using a dashboard, which I think probably a lot of ears in our audience went up, especially around understanding the ROI. Maybe you could talk about what you've seen to be challenges in the industry to understand where a kit is, particularly in the process, and how your dashboard ameliorates for that and is able to demonstrate not only where it might be in the cycle, but then also too, you mentioned about being able to measure the ROI from that. I would love it if you could talk a little bit more about that too.
Yeah, I never give you a full demo for that. But yeah, to put it in short, it's a very transparent system where you can see every metric right in front of you. You can see real time clients rate, where the kit is in its member journey, how many members opted in. You can view the results, it's the whole thing. And basically, when we have our calls with our partners, they don't ask us any questions that answers it all. It's all there at their fingertip and it's all role based.
And why is it important to know where a kit is? How have you used that in the past with your clients? How are they using that information to help them close gaps in care?
I think the number that everyone is chasing is the compliance rate. So what we are interested in how many people actually return those kits. The whole system measures the real-time compliance rates, as well as the rates, positives, negatives, the demographic, like what population is, yeah, what results are trending in what age groups, what demographics. That's what I know we are doing.
That's great. And I would think too, and I think we had a conversation about this. If someone's struggling with a kit, you know that they've received it, they don't know how to use it, you're able to intervene and provide education and other types of interventions that might help a patient get that kit back. Is that right?
We can employ live agents, multilingual agents. So we support live phone calls, incoming and outbound calls. So we have an in-house call center with bilingual team members who are very passionate about working with our populations. And they are taught to be respectful. They are taught to be patient and empathetic. And those are our core values, which go into everything that.
Awesome. And then you started off by saying that you had an end-to-end solution. We talked about the beginning, right? That end. Walk me through. You send the kit out, your clients can see where it is on the dashboard. Now the patient has mailed the kit back. What does that look like when it gets to you? How does that process finish out so we get to the end?
I'm giving away all the secrets.
And I was going to say, I wanted to go back to, because you said you'd have to give me a demo. I know you guys are going to be exhibiting at Qualapalooza and it's going to be in Arizona, but you also meet with folks that might be interested virtually too, so they could get the demo. But I know we're not going to show the demo here, but I want to make sure folks understand that they can get that from you as well. But for what you can share with me, you don't have to give away all your secrets, but I think it would be great just to hear, again, I know that's a differentiator for you, how you guys are doing things differently and helping to improve on that gap closure.
Yeah, absolutely. So to answer your last question, once the results are reported, we let the members' physicians know of their results and the results are shared with the health plan as well as the member and their primary PCP.
I just heard today, I got to hear OIG speak. And one of the things that they were talking about was, I know there's been a lot of talk in our industry of late around auditing and concerns over inappropriately identifying conditions for patients that might not be substantiated, might not be the accurate portrayal of health. But one of the other things that they said that they're looking for is to make sure that there's follow-up and there's that meaningful communication with the physicians. And you mentioned that. You've mentioned that now a couple of times. Could you talk a little bit more about maybe what you're doing that's important with engaging those physicians? What does it look like when you're providing communication? How are the physicians interacting with you? And then providing that full feedback loop.
All the physicians are notified of all the positive results of their patients so that they can reach out to the patients and take appropriate next.
Okay. What type of tests do you offer currently today?
Currently, we are offering all the tests around the gaps in care. So what we are seeing the most of is the colorectal cancer screening. We are seeing the diabetes, HbA1c measures, as well as we are seeing the kidney function test. That's the KED test. So those are the ones which are the most commonly utilized. We are also working on bringing a cervical cancer screening program with the self-select methods.
Awesome. What are the gaps that health plans are having the most challenges with closing? And in your estimation, why is that?
Yeah, it's the same answer that we just shared. The gaps that we are seeing most is, again, it's still the colon cancer screening, the KED, and the A1C remains pretty high. So I think that is one of the most challenging gaps in care.
Could you talk a little bit about women's health?
Yeah, so one of the things I'm really excited about right now is the advancements in cervical cancer screening. I'm passionate about women's health and improving health outcomes, particularly in women. So we know that the HPV testing has recently got approved for self-collect, and we are coming up with different ways where it can be also sent home. So we're excited about that measure and how we will play an important role in closing that gap in care.
I love the capabilities that are available today that weren't there before. So very important information to share with leaders out there that are especially challenged with this measure. So thank you. Thank you
Yeah,
so
our
much for
labs are, yes, and our labs are geared up for all the HPV screenings and wait to help men's Roseville HPV care.
I would love to have you back at a future date so that you could share with us how some of these programs are going for you. What recommendations do you have to quality teams that are trying to improve on HEDIS for next year?
My recommendation for you is to be proactive and not reactive. Start early. Please start early. Don't wait till the Thanksgiving time to send out your kits. That would be my biggest recommendation. But then again, network screening is one of the best ways to close your gaps in care. Really tailor your messages and have tailored, customized messaging to your members. Meet them where they are. And the last thing I can say is that find a partner to work with you, somebody who can actually demonstrate ROI, can give you real time glimpse into the whole program so that where you are and you can intervene as needed, and definitely stay proactive, start early, and and just know that everything you're doing is really great.
And I think what you say about having a good partner, if they're proactive and they have a system that's transparent, right? Like the dashboard that you mentioned having, I think is huge. One final question for you. I know we mentioned earlier in our meeting that you're going to be at Qualapalooza in about a week's time here, and would love to hear what you're looking forward to the most and what you're hoping to both give to the conference as well as take away.
Yeah, we are very excited about Quality. We are very excited to learn actually. And every time we go to RISE conferences, we learn a lot around the different, even things that we're not directly working with. I've learned a lot about risk, quality. So to listen to consultants like yourself. So it's a lot of learning. And also it just feels like now we know a lot of people and it feels like community. And it's just so great to see everyone in one place and to just collaborate with a lot of other vendors and to see our health plan partners. So it's a really great feeling. Some of the things that we are looking forward to is we're coming up with more AI enhancements for our dashboards, as well as validating more Apple screen tests around different measures. So I'm really excited, guys. Thank you.
Awesome. And if folks can't be at Qualapalooza next week, because I know that there will be some that can't join us, and I agree with you. It's one of my favorite things to do is to go to the RISE conferences because I think they're so beneficial. But in the event that folks can't make the journey, how would you recommend that they get in touch with you?
Absolutely. I'm available on LinkedIn. I can be reached directly on LinkedIn or by email or by visiting our website where you can find our contact information right there.
Great. I want to thank you for being with me today. I want to encourage folks that want to learn more to reach out with you. Like I said, I've been doubly impressed, not only with your solution, but with you as a leader as well. And looking forward to seeing you in just a few days. Thank you so much.
Thank you, Dr. Shannon. Very excited to see you soon. And thank you very much for the support and to be on your show.
Thank you.